For the deltoid muscles, this is the clavodeltoid. Its origin is the clavicle and fibers of the clavotrapezius. Its insertion is at the ulna, and it raises and rotates the humerus. It's the prime mover of the arm flexion and rotates arm medially and adducts the arm. For the acromiodeltoid, its origin is the acromion of the scapula, and the surface of other deltoids is the insertion, and it raises and rotates the humerus. And right here is the spinodeltoid, and its origin is the spine of the scapula and the deltoid ridge of the humerus, and it raises and rotates the humerus. And for the flexors and extensors, the posterior view will show the extensors, and the anterior view shows the flexors. And for example, the flexor carpi radialis is the prime mover in flexion, as well as the flexor carpi ulnaris and the flexor digitorum superficialis. For the extensors, the prime mover here is the extensor digitorum. Okay, for the muscles that move the forelimb, we have the triceps, the long head of the triceps here, and the connections for both the long head of the triceps and the lateral head of the triceps are the distal end of the humerus, and the lateral surface of the ulna is the insertion, and it strengthens the elbow joint and rotates the ulna. Then we have the brachialis. Its origin is the lateral surface of the humerus, and the ulna is the insertion point, and it's the flexor of the forearm. And then we have the biceps brachii. The origin is the glenoid fossa, and the insertion is the radius, and it is another flexor of the forearm. And the brachioradialis, its origin is the middle of the humerus and the lower end of the radius and adjacent ligaments, and its function is to rotate the head to supine, rotates the hand to the supine position. Okay, the sartorius, its origin is the crest and ventral border of the ilium. Its insertion is the proximal end of the tibia and the patella, and fascia and ligaments between. Its function is the adductor and rotator of the thigh and extensor of the shank. This is the gracilis. Its origin is the ischial and pubic symphysis. Its insertion is the aponeurosis, which passes to the tibia. Right here. This is the sembitendinosus. And its insertion, its origin is the transverse process of the second caudal vertebrae, and its insertion is the fascia of the shank, and it extends the thigh. Sembimembranosus is this muscle here, and its attachment is the ischium. Its origin is the ischium, and the insertion is the medial epicondyle of the femur, proximal end of the tibia, and it extends the thigh. The adductor longus, which has two femoral heads here, and the adductor longus, all their attachments are on the pubis and the medial part of the femur, and it adducts the thigh. This is the vastus medialis. Its origin is the femur, its insertion is the patella and adjacent ligaments, and it's the extensor of this shank. This muscle here is the rectus femoris. Its origin is the ilium near the acetabulum, and the insertion is the patella and adjacent ligaments. Its function is the extensor of the shank. The vastus lateralis is this muscle right here, and its origin is the greater trochanter and surface of the femur. Its insertion is the patella and the adjacent ligaments, and function is the extensor of the shank. So the postlateral thigh, this is the biceps femoris, and its origin is the tuberosity of the ischium. Its insertion is the patella and tibia, and the fascia of the shank. This is the caudofemoralis. I cut it off, but it's right here. And it is, origin is the transverse processes of the second and third caudal vertebrae. Its insertion is the patella, and it abducts the thigh and extends the shank. This here is the gluteus medius, and its origin is adjacent fascia, crest of ilium, lateral surface of the ilium, transverse process of the last sacral and first caudal vertebra. Its insertion is the greater trochanter of the femur, and its function is to abduct the thigh. I'm sorry, that was this one. That was the gluteus medius. This is the tensor fascia lata, and its origin is the ilium and neighboring fascia. Its insertion is the fascia lata, and it tightens the fascia lata. This is the semitendinosus, and its origin is the transverse process of the second caudal vertebra. Its insertion is the fascia of the shank, and it extends the thigh. This here is the semimembranosus, and its origin is the ischium. Its insertion is the medial epicondyle of the femur and proximal end of the tibia, and it extends the thigh. This muscle here is the tibialis anterior, and its origin is the proximal parts of the tibia and fibula and the first metatarsal, and its function is the flexor of the foot. This is the extensor digitorum longus, and its origin is the lateral epicondyle of the femur, and the tendon inserted on each digit, and it is a flexor of the foot. This muscle here is the fibularis muscle, the longest. It's this one right here. And its origin is the head and upper portion of the lateral fibula, and its insertion is by long tendon that curves under the foot to the first metatarsal and medial cuneiform, and its function is plantar flexes and everts foot, may help keep the foot flat on the ground. This muscle right here is the fibularis muscle brevis, and its origin is the distal fibula shaft, and its insertion is by tendon running behind the lateral malleolus and insert on the proximal end of the fifth metatarsal. This muscle here is the soleus, and its origin is the fibula, and its insertion is the calcaneus. This muscle here is the gastrocnemius, calf muscle. Its origin is the surface fascia, femur and proximal end of the tibia, and its insertion is at the calcaneus, and its function is the extensor of the foot or paw. And this is the calcaneus tendon, also known as the Achilles tendon, and its origin is formed by the distal end of the gastrocnemius and soleus, and its insertion is the calcaneus, and it's the thickest, most powerful tendon of the body, and it works by contracting the calf muscles. The tendon will lift the heel.